Hey y'all, and welcome back to my channel. It's your girl Marie Chalet, and in today's video we're going to be talking about the 5 traits that every nurse must have. We're going to be kicking it off with number 5, so make sure you stay till the very end so you can find out what the number 1 must-have trait is as a nurse according to me. So let's get into the video. Number 5 is organization. It is so important to have organization skills as a nurse. If you don't have organization skills as a nurse, you are going to be scattered. Scatterbrain is not okay as a nurse. It is something that we all work on all the time, and some of us are better than others. However, if you're not organized as a nurse and you're taking care of multiple patients, it is going to make your day hard. If you're taking care of 5 patients on a med-surg floor and you're not organized to know which patients have what and what you need to be doing first, it's going to make your day very stressful because you're not going to be able to keep up with what your patient's needs are. So just getting your organization skills together to keep track of your patients and your patient's needs are going to help you out so much during your day. That includes charting, that includes seeing patients and knowing what patients to see first, and even knowing what supplies you need to be bringing into which patient's rooms and what you need to keep on you at all times. Now, organization goes hand in hand with our number 4 trait that you must have as a nurse. That number 4 trait is time management. Oh my gosh, how important is time management? I admit this is something that I struggle with till this day, and I really struggled with working in the skilled nursing facility or SNF when I did that for about a year and a half. When you have about 20 patients to take care of, time management is a necessary. Things that can help you develop your time management skills is paying attention and asking questions to nurses that you see have great time management skills. There are some nurses that get to work at 7 o'clock and they leave at 3:30, charting done, all patients taken care of, all treatments done, medications passed out on time, everything. So following in those nurses' footsteps, asking them questions, and just paying attention to the things that they do to keep up with that time management is going to help you. Keep notes if that's going to help you, but keep in mind as you continue to work as a nurse, as long as you are practicing these skills and working on them, they will get better. So if you're having a hard time, don't give up on yourself. Just keep practicing, keep learning, and keep refining those things that you learn. It will come to you. Just know that it's something that you have to keep working on. The number 3 thing, we're getting really important now. It's getting heavy quick, y'all, is attention to detail. You must be able to notice small details about your patients, about paperwork, about things that are going on in documentation, and things that are going to affect your patient's life. There are sometimes very small things that are missed by nurses that if a nurse that had that great attention to detail trait built up would not miss, and they can save their patients' lives, literally. It's reported that about 50% of cold blues showed signs of it within 48 hours prior. Those are things that shift after shift after shift after shift of nurses miss that could have been caught before a cold blue happened. Make sure that you're paying attention to those little changes in your patients that can happen even over a few hours in your shift. If your patient starts to talk weird, say things that you're like, this patient wasn't saying that before. Your patient starts to slowly lose level of consciousness. They're a little more yellow than you remember them being. When you notice these small changes, talk to your colleague, talk to your charge nurse. Maybe even if it's a huge change by now, you have to talk to the doctor. But just make sure that you are paying that close attention to detail so these things aren't missed. Again, this is another thing that is built over time for some people. people, but it's really good to know that you need to pay attention to these things to be a great nurse for your patients. We are moving on to number 2, which is critical thinking. Critical thinking is so important as a nurse. It's so important as a nurse. If you're an experienced nurse, you're probably wondering what could be more important than critical thinking. Don't worry, we're gonna get there. But you must possess the trait of critical thinking as a nurse. Not everything is black and white in nursing. There is a ton of gray area. When you come across that gray area, you need to be able to put your knowledge to mind to say, hey, something is not right, something is different, but I haven't seen this before. Even if you haven't encountered a situation before, you need to be able to respond to it, right? You need to be able to respond to that situation even if you've never encountered it before. How do you do those things? How do you develop that critical thinking skills? You rely on the knowledge that you have. When there are certain things that start to come up, all right, now if you've been waiting and the suspense is built up enough for you, we're going to move on to our number 1 trait that every nurse must have. Now this one has 2 combined, but I feel like they go hand in hand. Those are, for 1, care. You must be a caring person as a nurse. It is a must-have. And also compassion. I feel like care and compassion go hand in hand, and you must possess both of those traits as a nurse to be a great nurse. Now, I looked up the official definition so I can give it to you so you can understand why it's so important to possess these 2 traits as a nurse. I mean, it's kind of self-explanatory. We are caring for the patient, but let's look into it. So this is the definition from Oxford. So care is a verb, and it means to feel concern or interest, attach importance to something. So what we are doing as nurses is attaching importance to what the patient is going through, what the patient is feeling. The reason why the patient came to see us today, is in front of us today, is in the hospital today, is in the emergency room today, is in the mental health facility today. Whatever the patient is there for, that is what we are attaching importance to. We have to be able to do that as a nurse, because if we are not able to attach importance to, we are not going to do our jobs right. Even when you feel like the patient has come in for the most trivial reason, they feel like they came in for a good reason. They felt like that was their only option. So we need to be able to connect with the patient, even if it's an education session for that patient. As for compassion, from the Oxford Dictionary, it is to be sympathetic, have pity and concern for the suffering or misfortune of others. Now, as nurses, we definitely want to be empathetic, to be able to place ourselves in the shoes of our patients. This will help us, again, to not throw off a patient's concern as trivial, even if you feel like it is. You want to make sure that you are giving that patient everything before just deciding that, oh, this is trivial, oh, I'm not going to take care of him. The day you do that is the day you lose a patient, and it's not okay. So that's why I feel like these 2 traits are the number 1 things that go hand in hand with being a great nurse. Now, if you feel like you still want to be a nurse and you have every single one of these traits, or are willing to develop these traits, go ahead and click here in my series, How to Become a Nurse, where I lay out everything you need to know on how to become a nurse. I appreciate y'all for watching. Thank you. I will see y'all in my next video.